You know that feeling, like when stress hits or you're rushing, and you suddenly realize your breath is just tight, shallow.
Oh, yeah, totally. Or
Yeah.
maybe you're even holding it without realizing.
Exactly. Or when anxiety makes it feel impossible to get a really full, deep breath.
It's so common. And it
Yeah.
feels like such a basic, automatic thing, breathing. Our bodies just do it.
Right. Thousands of times a day without us really thinking about it.
Wow.
But what if? What if that automatic action could be like consciously controlled, turned into a genuinely powerful tool? What if we could think of it as actually exercising our lungs? Like we exercise our muscles.
It's a great way to frame it. And that's pretty much what we're taking a deep dive into today.
Yeah, we've been digging into this really fascinating source. It's a health article, seems well backed by medical review research.
Right. And it really explores the fundamental purpose, the kind of surprising range of benefits, and also the different ways we can intentionally use our breath.
So our mission here is to unpack all of that for you. Cut through the noise, find the most important stuff, and really understand how something so basic, how you breathe, can actually have such a big impact.
On everything from physical conditions to how you manage stress, anxiety.
Exactly. It's about getting informed quickly, getting those aha moments, and, skipping the feeling of being totally overloaded with info.
Let's do it.
Okay, so let's jump right in. At its core, the source talks about the fundamental purpose of doing these breathing exercises. Why bother focusing on something our bodies do naturally anyway? What's the main goal?
Well, the article makes it pretty clear. It's fundamentally about improving your lung function, making them more efficient.
Okay.
And it's a key strategy for helping manage various health conditions. Plus, it's widely known for its pretty potent effect on relieving stress and anxiety.
It mentions this idea of getting rid of stale air. Can you kind of unpack that? What does it mean and why is it important?
Yeah, so think of your lungs like balloons that maybe don't fully empty out with each breath. Regular intentional breathing helps you exhale more completely. You push out that residual kind of stale air.
Okay, so it makes more room.
Exactly. More space for fresh oxygen when you inhale. And critically, it supports and strengthens your diaphragm. The source really highlights this as the single most important muscle for breathing.
Right, that dome-shaped muscle under the lungs.
That's the one.
I can see why strengthening that main muscle would be key. Is this, especially vital for people who already have breathing difficulties?
Oh, absolutely. If you have conditions like, say, COPD, where breathing is tough, that stale air can build up.
Right.
And that limits how well your diaphragm can move and work. So your body tries to compensate. It starts using other muscles.
Like in your neck and chest?
Yeah, neck, back, chest, these accessory muscles. That's really inefficient. It's tiring, you don't get as much oxygen exchange, and it just wastes energy.
Ah, okay.
So breathing exercises are specifically taught to help reverse that. Get the diaphragm working properly again, improve efficiency, and just make breathing less exhausting work.
That makes total sense for managing difficulties. But the source suggests the impacts are, broader than that, right? It's not just for people with lung issues.
Not at all. Improving lung efficiency, controlling your breath, it has these knock-on effects. It can genuinely help athletic performance, better oxygen delivery.
Okay.
And on the flip side, mastering that controlled, slow breathing, it acts directly on your nervous system.
How so?
It stimulates the parasympathetic nervous system, that's your body's rest and relax mode, while at the same time, it dials down the sympathetic nervous system, your fight or flight response.
So it's like a manual override for stress.
Pretty much, like having a switch to calm your body's stress state.
Okay, here's where it gets really interesting for me. The sheer range of specific health benefits the source lays out. It goes way beyond just feeling a bit calmer. What stands out?
The evidence across different conditions is, it's quite compelling. Take reducing asthma symptoms, for example.
Okay, yeah, that affects a lot of people, like 1 in 13 in the US.
Something like that. And obviously, breathing exercises aren't a cure for asthma. But the source mentions that some, admittedly limited, research suggests they can be a helpful management tool.
For mild to moderate cases.
Especially for mild to moderate, yeah. They might help with those hyperventilation symptoms that can happen during an attack, potentially improving lung function, quality of life.
Yeah.
It's promising, even if more research is needed.
Okay. And what about something like lowering blood pressure? Hypertension is a huge risk factor.
Right. And here, the speed of your breathing is really the critical thing.
Slowing down.
Exactly. The source emphasizes slow breathing, specifically getting below 10 breaths per minute, with slow, rhythmic exhales. That seems to be the key.
And what does that do physiologically?
Well, it can lower adrenaline levels, boost endorphins, the feel-good chemicals, and even reduce blood acidity. All factors that contribute to lower blood pressure. They even cite a review of, I think it was 17 studies, supporting slow or controlled breathing. It's being pretty effective, especially maybe for people with pre-hypertension or younger folks who might be hesitant about medication.
It's pretty remarkable that just consciously slowing your breath can have such a measurable physical effect.
Isn't it?
Okay, now the one everyone probably thinks of first. Decreasing anxiety and stress. Super relevant. The source notes how prevalent it is, right? Like over 30% of adults experience anxiety disorder.
It's huge.
Yeah.
And breathing exercises are a really widely used, effective tool here, often alongside therapy, of course.
Right.
But they absolutely can improve mood, cut down overall stress levels, and physically slow down both your heart rate and how fast you're breathing.
Okay.
What I found particularly interesting was to mention that in some situations, they might even be more effective than just general mindfulness practices alone.
Really? More than mindfulness.
Potentially, in some cases. The source pointed to a small study where practicing diaphragmatic breathing, belly breathing for 8 weeks led to significantly lower cortisol levels.
That's the main stress hormone, right?
Yeah, lower cortisol and improved attention. That's a powerful kind of 2-for-1 benefit right there.
Okay, this next one genuinely fascinated me. Reducing pain. It feels almost counterintuitive that focusing on breath could help with physical pain. How does the source explain that?
It does seem strange, doesn't it? But the idea is that intentional breathing can actually help with both acute short-term pain, post-op pain, or labor pain.
Wow, labor pain.
Yeah, and also chronic pain, like persistent low back pain. The source references reviews of studies supporting this. 7 studies for acute labor pain, 13 for chronic low back pain. So there's research behind it.
So what's actually happening in the body then? Is it just like a distraction technique?
It seems to be more than just distraction. It's kind of the aha moment here. There are a few potential things going on. One really intriguing idea is that intentional breathing might stimulate endogenous opioids.
Your body's own painkillers.
Exactly. Your body's own natural pain-relieving chemicals. Secondly, it deeply promotes relaxation. And that directly helps reduce those secondary things that often make pain feel worse. Anxiety, anger, depression, even confusion.
Okay, that makes sense. Less tension overall.
Right. And thirdly, remember we talked about strengthening those key breathing muscles. Diaphragm, pelvic floor, deep abs.
Yeah.
Strengthening those can actually improve your posture and core support. And that can mechanically reduce certain kinds of pain, like chronic low back pain.
Ah, so it's physical and psychological.
It seems to be. The key contrast is, instead of instinctively taking those short, shallow breaths or holding your breath when you feel pain, which often makes it worse.
Right, which is what most of us do.
Yeah, you're intentionally breathing through it. And that might tap into these really complex pathways.
Fascinating. Okay, and for those dealing with more serious progressive lung conditions like COPD.
Yeah, COPD is obviously a huge challenge. And breathing exercises like diaphragmatic breathing and pursed lip breathing are actually standard parts of pulmonary rehab programs.
So doctors recommend them.
Absolutely. The source highlights reviews and studies showing that these techniques, especially when you combine them with exercise, can lead to real, concrete improvements.
Like what specifically?
Things like better breathing mechanics overall, improved quality of life scores, better results on pulmonary function tests, greater exercise endurance, stronger respiratory muscles, and a significant reduction in that feeling of shortness of breath. Dyspnea.
Right, dyspnea. So they're really essential tools for managing the disease day to day.
Definitely, they help people manage the progression and feel better.
Okay, let's unpack this a bit. So we know why intentional breathing is powerful and what kinds of benefits it can offer, but how do you actually do it? The source lists several different types of techniques. It's not just one size fits all.
Exactly. Different techniques might serve slightly different purposes, or maybe just feel easier or more effective for different people or in different situations. The source gives a really good overview of some common ones.
Okay, let's start with one I feel like I've heard mentioned quite a bit. Box breathing.
Right. Also known as square breathing, or sometimes tactical breathing.
Tactical.
Yeah, this one was actually developed by the U.S. military. The idea was to help manage stress and improve performance in really high-pressure situations.
Ah, okay. Makes sense. How does it work?
The pattern is very structured, very balanced. You inhale through your nose for a count of 4, then you hold your breath for 4 counts, Then exhale through your mouth for 4 counts, and then hold your breath again for 4 counts.
In 4, hold 4, out 4, hold 4. Like a box.
Exactly. You just repeat that simple cycle. It's very grounding, very rhythmic.
Okay. Then there's deep breathing, which you mentioned, also called diaphragmatic or belly breathing. This sounds like it ties directly into using that key diaphragm muscle.
It absolutely does. This is really foundational technique, used for stress, anxiety, managing conditions like asthma, COPD, high blood pressure, lots of applications.
And how do you do it properly?
The instruction is usually to place one hand on your belly and maybe one just below your rib cage so you can really feel the movement.
Okay.
Then you inhale slowly through your nose, and the focus is on letting your belly expand outward while your chest stays relatively still.
Right. Breathe into the belly, not the chest.
Exactly. Then you exhale slowly through your mouth, feeling your belly gently draw back in. The source gives a pretty helpful tip for learning this.
Oh, yeah.
Imagine you're smelling some delicious food as you inhale through your nose. And then you gently blow on it to cool it down as you exhale through your mouth.
Yeah.
It just helps guide the breath down into the belly area.
That's a good visual. Okay. And there are variations on that deep breathing idea, too.
Yes, the source highlighted 2 notable ones. First, cyclic sighing.
Sighing, like actual sighing.
Pretty much. It intentionally focuses on making the exhales really long, like a deep sigh.
Okay. Why?
Doing this specifically activates that parasympathetic rest and relax nervous system really quickly. Helps slow your heart rate, brings on a sense of calm, and can rapidly reduce feelings of anxiety and just your overall breathing rate, sometimes in as little as like 5 minutes.
Wow, that fast.
Yep.
Okay. And the other variation, humming breathing. Source called it bumblebee breath.
Yes, Pranayama is the yoga name. For this one, you inhale through your nose, and then as you exhale through a closed mouth, you make a humming or a buzzing sound, like
Huh, like a bumblebee.
Exactly. It's said to be particularly helpful for promoting sleep and also for relieving stress and maybe even anger. The vibration itself can be quite soothing for some people.
Interesting. Okay, what about 4-7-8 breathing? That one seems quite popular for calming down quickly.
It is. It was developed by Dr. Andrew Weil, specifically aiming to calm the nervous system.
And the pattern is in the name.
Yep. Inhale through your nose for 4 counts, then hold your breath for 7 counts, and then exhale slowly through your mouth for 8 counts, making a gentle sort of whooshing sound as you exhale.
So the exhale is twice as long as the inhale.
Right. That long exhale is key, and you usually repeat the cycle up to maybe 4 times.
Gotcha. Okay, pursed lip breathing. That sounds like it might be especially useful for certain conditions you mentioned.
It is. It's particularly helpful for people with COPD or emphysema.
How does that one work?
You inhale slowly through your nose, and then you exhale slowly through lips that are pursed, almost like you're gently blowing through a straw.
Okay, pursed lips. What does that achieve?
It does a few things. It helps slow down your breathing rate overall. It also creates a little bit of back pressure in the airways, which helps keep them open longer. This relieves that feeling of shortness of breath, makes breathing feel less effortful, and improves the exchange of oxygen and carbon dioxide.
Seems really practical. Any cautions?
Yeah, the source does caution to only repeat this for maybe 3 to 5 breaths at a time. Doing it too much could potentially make you feel lightheaded or have other negative effects. So short bursts.
Good tip. Okay, then there's resonance breathing. How is that different from just regular deep breathing?
Resonance breathing is a form of belly breathing, so inhale nose, exhale mouth. But it's done at a very specific, purposeful pace, usually somewhere between 4.5 and 7 breaths per minute.
That's quite slow.
It is. The goal is to find a rhythm that kind of resonates with your body's natural rhythms. This can help with stress reduction, lowering blood pressure, improving mood.
Okay.
And it's also sometimes used to help people become more aware of, or maybe even gain some control over, their heart rate variability, HRV.
HRV, what's that?
Heart rate variability. It's basically the variation in time between heartbeats. It's seen as an indicator of your nervous system balance, your resilience to stress.
Ah, interesting. So finding that resonance frequency helps with HRV.
That's the idea.
Okay.
Yeah.
And finally, alternate nostril breathing. This sounds a bit more complex.
It's a technique that comes from yoga practices. Nadi Shohana is the Sanskrit name. It involves using your hand, usually your thumb and ring finger, to gently close one nostril while you inhale through the other.
Okay.
Then you switch fingers, close the second nostril, and exhale through the first one. Then you inhale through that same nostril, switch again, exhale to the second. You follow a specific sequence, alternating nostrils for inhale and exhale.
Why would you do that? What are the benefits?
The source mentions possible benefits like improved attention and focus, and maybe decreased blood pressure. It's seen as a way to balance the energy flow in the body or balance the nervous system in yoga philosophy, a different approach to regulating the breath.
Okay, wow. So lots of different techniques to potentially explore, but these sound pretty simple on paper, but the source notes, they might actually be challenging when you first start out, especially if you have chronic conditions.
Absolutely. And that's really important, not to feel discouraged if it doesn't feel natural or easy right away.
Yeah.
It's like learning any new skill, right? Be patient with yourself, take your time, go slowly. Consistency over time is way more important than getting it perfect immediately.
Right, just keep practicing. And there was a really crucial piece of advice, particularly if you're hoping to use these techniques for managing anxiety or stress.
Yes, this is key. Practice these techniques when you are calm first.
Not when you're already freaking out.
Exactly. Build that familiarity, get comfortable with the mechanics and how it feels when your body is already in a relaxed state. Trying to pull out a brand new breathing technique for the very first time when you're in the middle of high stress or a panic attack, that can be really difficult, maybe even frustrating.
Yeah, I can see that.
So build that muscle memory, build that positive association when you're feeling okay. Then it's there for you when you need it more.
That makes a lot of sense. Did the source give any indication of how often or how long you need to practice to see results?
Yeah, they pointed to some research examples. Like one study showed practicing deep breathing for 10 minutes twice a day for 9 months led to a measurable reduction in stress levels.
9 months is a commitment. Any shorter term stuff?
Definitely. Other studies found that practicing just 2-3 times per week for maybe 4 to 8 weeks showed improvements in things like lung function, back pain, and quality of life.
Okay, so even shorter, regular practice can help.
It seems so. But they also wisely suggest, talking to your healthcare provider, get personalized advice on the best frequency and duration for your specific situation or health condition.
Good point. And that brings us to a really, really vital point the source emphasizes. Knowing when difficulty breathing isn't something a breathing exercise can fix. While these are incredibly beneficial, shortness of breath can be a symptom of something serious.
Absolutely crucial point. Shortness of breath, dyspnea.
Yeah.
Sometimes it's tied to stress or anxiety, and that's where these exercises can be incredibly helpful.
Right.
But it can also be a signal of a genuine medical emergency that needs immediate attention. Things like a pulmonary embolism, a blood clot in the lung, a heart attack, a severe allergic reaction like anaphylaxis.
Pretty serious stuff.
Very serious. Or it could indicate an underlying condition that needs proper diagnosis and medical management, like asthma that's not well controlled, COPD, heart failure, things like that.
So when does the source say, okay, it's time to seek medical advice? Not necessarily emergency, but time to see a doctor.
According to the article, and groups like the American Lung Association back this up, if your breathing becomes harder or difficult for no obvious reason,
Okay.
or if you develop a persistent cough that won't go away, or a wheeze, that kind of whistling sound in your chest when you breathe, definitely contact a healthcare provider. They need to figure out the cause.
Right. Don't just ignore those signs. And when is it a situation that needs immediate medical attention? Like go to the ER, call 911 kind of situation.
This is the really critical information to know. You need immediate care if your shortness of breath comes with other significant symptoms, like chest pain or pressure, fainting, nausea.
Okay, those are red flags.
Big red flag.
Oh.
The source lists other critical markers too, things that mean you need help right away. If your lips or your fingernails are turning bluish,
Oh, wow.
if your nostrils are flaring wide every time you inhale, if you're breathing really, really fast, like 30 or more breaths per minute, or if you're having trouble walking or even talking at a normal pace because you just can't get enough air.
Okay.
That list isn't exhaustive, obviously, but those are really clear signs that something serious is happening and needs immediate medical evaluation. Don't wait.
That's really important safety information. Okay. So wrapping this up, what does this all mean? We've covered a lot of ground here, from the basics to specific techniques to safety.
Yeah, I think the key takeaway is just how valuable these breathing exercises really are. They offer a concrete, accessible way to improve how your lungs work, gain more conscious control over your breathing, and really effectively manage stress and anxiety.
And that regular practice, even if it's just for short periods, can genuinely lead to better respiratory health overall and help ease symptoms across a whole range of medical issues.
Definitely. But like you said, it's so important to keep that safety message in mind too.
Right. Difficulty breathing isn't always just stress. If you get those sudden, severe symptoms, chest pain, dizziness, really rapid breathing. Blue lips seek immediate medical help. Don't try to just breathe through it.
Exactly. Use these techniques. They're powerful tools for well-being. But always listen to your body and get professional help when something feels seriously wrong.
So maybe consider this as we finish. How powerful is it really that something our body does completely automatically, thousands of times a day, without any conscious thought, can become such a potent tool for improving our physical and mental health just by choosing to make it intentional? Could dedicating just, say, a few minutes each day to conscious, focused breathing unlock some unexpected benefits for you?
It's definitely worth exploring.
Maybe just try one of the simpler techniques we talked about. See what happens. Notice how you feel.